Hi, my name's Alec Thompson, and today I'll be discussing how exactly I plan to use my bachelorette degree in my career and my life, not only currently but in the future. So to start off, I'll explain some ways in which my career currently integrates the use of a bachelorette education, and I'm going to start by explaining what I do right now. Currently, I work full-time at Mercy on a cardiac pulmonary step-down unit. It's 4D. But I also work part-time at Greene County Jail. So I work nights at Mercy and I work days at Greene County Jail once a week. But the way that this education has prepared me for both of those is the ability to adapt my nursing and my composure for different settings. So for an example, at the jail, it's not as professional, and I don't mean that in a bad way. I just mean that you have to be a certain way towards your inmates or they take it the wrong way. At the jail, we work with clients who are manipulative and often dangerous. And so I have to watch myself, the things I say, the things I do, and even how I compose myself around my fellow coworkers and correction officers. The inmates watch you, they watch the things you do, and they'll catch on to any little thing that they see is inappropriate. And at Mercy, it's more professional, so we go in and our clients are relying on us for help, and they respect us for the most part, and it's just a different aspect. So I have been able to practice in a variety of healthcare settings. I've already started to do that, and this program has helped me to be able to adapt to both the settings I work in currently. Another thing is that being a bachelorette prepared nurse, I have to be able to engage in taking care of myself so that I can care for others. And that's one thing I've learned this year is how important self-care is. Being a nurse is exhausting and it's challenging both physically and mentally. And there's days where you just walk away and have to give yourself time. And that's something that I've learned this year in my first year of nursing, is that I really do have to give myself the care I need. I currently go to the gym 5 to 6 days a week to keep myself physically fit, and I also use that as an outlet. Work is hard and it's not always glorious, and so part of me taking care of myself and the things I need to do for me is getting to the gym and eating healthier. And in doing that, I can better handle the 12-hour, 13-hour shifts with the patients. And so that's how I engage in my own health to better prepare and to care for my patients. And then another thing that I integrate is a care for patients across the lifespan. So at the prison, I take care of 18-year-olds. And I take care of 90-year-olds, and the same thing goes for 4D. And we see a lot less younger population on 4D with it being cardiac, but we do have quite a few drug-induced overdoses or drug-induced heart surgeries that we have to take care of. So some of those patients are 21 years old was the youngest I taken care of. So I have to be able to adapt in a personal level. Walking into a room with a 20-year-old versus a 90-year-old, I can't compose myself the same way. I can remain professional, but there has to be a certain level of relation, especially with a 20-year-old female. For example, you have to build a relationship that allows her to trust you and trust the things you're doing with her. So this degree has allowed me to figure ways out to do that. Like with the 20-year-old, I sat down at her level and I talked to her about her life. I'm 23 years old, so I was able to relate, kind of told her some examples of my own life currently, and kind of gave her hope through that. So this is a continuous level of care, or a continuous development in my career. So not only will I stop at my bachelor's, but another thing I plan to do is get my DNP. I plan to work as a nurse for the next 3 years to get solid ground. And then I want to continue on my education to get my doctorate for nurse practitioner or my FNP. I'm not really sure what I want to specialize in once I get there, but I do know that I plan to continue my education past my bachelor's in the next 3 years. Currently, I'll be finishing up my first year as a nurse here in December, and after that, I plan to work at least another half a year and then maybe start travel nursing. I don't know yet if I want to go into correction nursing or if I like bedside nursing, but I think that in the next year and a half here, I'll be able to decide that and kind of further my education and my nursing career through travel nursing in one of those two or both. There's really no limit. So that's how I plan to engage in lifelong learning, is to continue my education and continue my career in both correctional and bedside nursing and kind of see where it leads me. The next thing is that through this course, we've learned a lot about spirituality and nursing and a lot about being flexible as a nurse to our patients' needs. And so one example is with my patients. This degree program has allowed me to sit down and pray with them. It's allowed me to bow my head in prayer when family's praying. And it's allowed me to hold hands with those family members who are praying in a circle. I realize now that if patients are in need of something, I can call pastoral services to be for their assistance if I feel like it's out of my realm of scope of practice. And there are times when things get too involved and I just feel that the chaplains can do a better job of explaining or comforting my patients than I can.